When we first heard about the sudden closure of the homeless shelter on Long Island, we had a lot of questions. Among them, what, if anything, is being done to locate and help the people forced out? We posed that question last week to Jonathan Scott of Victory Programs.
I think that we unfortunately often have to wait till the resident or client is ready to come to us. But there are outreach workers within the city of Boston who absolutely do that kind of work and try and make sure people are as safe as possible.
And those outreach workers do more than offer people food and shelter. WGBH News reporter Anne Mostue recently spent a day following around a local doctor who sees his patients right on the street.
Just got to print it out and put it in my
Dr. David Munson doesn't wait for patients to come to him. He and caseworker Carlos Morales spend their weekday afternoons walking the streets of Boston, caring for the homeless in the streets.
All right, I got a bus pass. You need some bus passes?
Sometimes it's as simple as offering a pair of clean socks, and sometimes it involves a checkup. Jim DeRosa is complaining of foot pain, so Munson examines him.
I'm sorry, JD. It's just water.
The sudden evacuation of the Long Island shelter last month left about 700 more people without a place to go.
There's a lot of people that got evicted, and that's why the homeless situation is a little tight right now.
50-year-old Fred Mazza says he occasionally slept in the Long Island shelter, but he prefers to sleep on the street.
The only time I go to the shelter is when it gets to be about 10 degrees below zero.
If access to Long Island is restored, Mazza says things need to change.
I hope that security gets a little bit better. People will steal the teeth out of your mouth if they have the opportunity. And that's why I don't go to the shelter, because I feel safer out on the street.
And that's something outreach workers like Munson and Morales understand, making it even more difficult to keep track of an ever-transient population. And Munson says, working out of a Pine Street Inn van once a week, he's noticing more patients.
Since the bridge closed in early October, there's probably been, there's some percentage, 25, 30% more folks out on the van.
Munson says they haven't been overwhelmed yet.
If we have a winter that was anything like last winter, where it was really cold for many nights in a row and all the emergency shelters were full, and we're already there. We're already with all the emergency shelters full today. And, so I think we might really see some problems.
And Morales points out that closing the Long Island shelter has reduced the city's available detox beds from 135 to 75.
But now it's getting much more difficult to place a patient. And when you're calling to say, call back in a couple hours, you do that, there's still no bed. You call back, there's just no beds.
So these men continue to monitor the homeless population from one case to the next, making calls when there's an urgent need for care or a bed.
There can be real consequences in the winter to sleeping outside in terms of just exposure-related injuries, if that's frostbite or other things. And I just worry about that as we get into that season. And I think the timing of the bridge closing was just unfortunate in that setting.
Anne Mostue, WGBH News.
Of course, Dr. Munson and Carlos Morales are not the only people expanding their outreach efforts. Linda Downey is the president of Pine Street Inn, which offers a range of services to thousands of homeless men and women. Welcome to Greater Boston.
Thanks, Emily.
So, Linda, do you wait mostly for people to come to you, or do you also do outreach on the streets?
So we have two outreach programs. One is the Pine Street Inn van. We have two vans that go out every night from 9 at night till 5 in the morning. We provide transportation for people who don't want to come in.
Who don't want to come in.
Yeah, well, for people who don't want to come in, we do food, blankets, some very basic first aid. We work very closely with Healthcare for the Homeless as well. And we try and do referrals directly from the street to detox, in some cases, believe it or not, to housing. And then we have a team of about 3 teams of 3 each who are out doing daytime outreach, looking for people, trying to do referrals, trying to talk people to coming in, frankly, before it gets cold and before it gets dark.
So Pine Street has really changed its entire mission, which is, I think, fantastic. I mean, you're trying to get more people into their own living situation, and you've got how many of these little houses do you have? They have their own bathroom, their own little kitchenette with 2 burners, and how many of those do you have now?
So we're close to about close to 900 units of housing, either we've got now or in the pipeline. We've actually hit a big milestone this year. We have more housing units now than we have shelter beds.
Yeah, that's
and those
good.
Housing units are geared to people that have been homeless a very long time and have some kind of disability, like a mental illness, like serious substance abuse. many of the folks that we're working with that move into those units have pretty serious health issues as well.
Well, I was going to ask you, how then do these people sustain living by themselves if they have serious mental health issues or substance abuse issues? Aren't you worried about them using the stove or not taking care of the unit? I mean, how do you monitor that?
Well, we actually have staff who work, case managers who work in housing. That's been one of our big shifts. We've moved actually money out of shelter and into housing so that the case managers are working with people directly in housing.
So they go in and help them?
About everything. How do you cook for yourself? Where are you going to shop? How are you going to stretch your money so you can shop? How do you deal with some basic stuff? What are you going to do with yourself during the day if you're not working? How do we connect you with the community?
Okay, so
all
that's
those
the other
things.
thing. You say that I think a third of their income goes to pay for the shelter. Do they actually have incomes?
Some people do. Some people have income, they're disabled and they're getting some form of disability. Some people are older and are getting Social Security, and a third of their Social Security income is going towards paying the rent. And then some people are working, so it's a combination.
Now, this issue with the Long Island shelter, have you felt the effects of that as well?
Yes. So our men's in shelter numbers are up 10% over last year, and our women's in numbers are up 22%. So the women's numbers are
because there were a lot of women out there,
right.
weren't there?
There were a lot of women out there, and even though we worked very closely with the city and we replaced, they had about 400 shelter beds. Leaving aside, again, the substance abuse programs, we replaced about 350 of those 400 shelter beds. You know, Pine Street's doing some, Healthcare for the Homeless is doing some, St. Francis House, Pilgrim Shelter, everybody's doing a little bit to try and pick up the slack. But last night we had 75 people sleeping on the floor, and tonight's going to be freezing, exactly. So I am very worried that number will double or triple as we get into the winter.
What did you make of the city doing this so precipitously?
Well, for us, it wasn't precipitous, frankly.
No?
We have, despite, I think, what the message that's been sent out there, we started meeting with Boston Public Health Commission and all the other shelter providers out on the island. Well, but we've been meeting for a good 6-8 months trying to figure out what's the plan should the bridge go down. There was
they got
messages.
3 hours notice, so
well,
something was...
I think nobody expected that short notice, Emily. I totally agree with that, but I think we all knew there was risk. I think we all knew the bridge, there was a possibility of the bridge going. We moved our programs off the island in September. So I think there was definitely the message from the city was, you know, we're worried about it and we think it's, you know, there's more issues going on than we originally realized.
All right, Lydia Downey,
Thank you.
Pleasure to have you. Thanks so much.